I'm Lon Cullen. I'm Chair of the Board of Directors for Prairie Mountain Health. At this time, I would like to welcome everyone to our annual general meeting. As part of the meeting, I'd like to acknowledge the land upon which we live and operate. And Prairie Mountain Health facilities are located on Treaty 1, 2, and 4 territories, the original lands of the Dakota, Anishinaabe, Cree, Oji-Cree, and the national homeland of the Red River Métis. Prairie Mountain Health acknowledges the harms and wrongs of the past and is committed to providing culturally safe healthcare that is without racism and discrimination. Prairie Mountain Health recognizes that improving the health status and health outcomes and equitable access to quality healthcare for Indigenous people, it is essential to achieving Prairie Mountain Health's vision of health and wellness for all. We dedicate ourselves to moving forward in partnership with First Nations, Métis, and Inuit individuals, their families, and communities in the spirit of reconciliation and healing. Prairie Mountain Health currently operates under the direction of an appointed board of directors. Directors are appointed by the Minister of Health, Seniors, and Long-Term Care. I want to acknowledge our current board members who are Donna Davidson, Jana Knight, Carla McLean, Judy Swanson, Jody Parsonage, David Morio, Lori Rodich, Wanda Sandy, Wade Schott, and Shep Castra. Although board members reside in various communities throughout the health region, they represent the entire region at the board table. Through provincial legislation, the board plans, manages, delivers, and monitors and evaluates regional health services. The board does this in a variety of ways, including providing sufficient oversight measures and ensuring the organization accountability by monitoring and evaluating its performance and establishing a 5-year strategic plan. The board would also like to acknowledge community partners who assist the board and represent the community at large. Two in particular are Brenda Huco and Ian Gerard. Community partners are volunteer members of the public who join PMH committee as an equal member to offer insight and feedback from the public standpoint. Brenda serves on our Quality Patient Safety Committee, and Ian serves on the Board Finance Committee. Thank you, Ian and Brenda. To our executive management team leadership team, we sincerely thank you for your leadership, dedication, and commitment to another challenging year in healthcare. To our staff, there are not enough words to say thank you for your contributions each and every day. Day in, day out, you ensure the best possible care and services provided within Prairie Mountain Health. Your dedication and commitment to providing healthcare remains extraordinary. Your compassion exemplary. Thank you very much. To all our community and patient partners, thank you for working with us, challenging us, supporting us, and being patient with us, especially during difficult times. I would like to now introduce Prairie Mountain Health Chief Executive Officer, Trina Slate.
Thank you, Lon, and thank you so much to the Board of Directors for their continued support, direction, and dedication. As our annual review primarily looks back at this past fiscal year, we would like to take a moment to reflect back on the unthinkable tragedy which occurred near Carberry on June 15th, 2023. On that fateful day, emergency response for an event no one ever assumes possible was put into action. Prairie Mountain Health, Shared Health, STARS Air Ambulance, and Manitoba Health all came together in critical incident response. It was an all hands on deck approach to that day and for many days and weeks following the event. Our condolences and thoughts remain with the survivors and families, to those who were lost and injured, the first responders and their families, the witnesses, as well as the communities of Dauphin, Carberry, Nipoa, and Brandon. The ripples of an incident such as this created an indelible mark on individuals, families, and communities. One hopes to never experience, witness, or be left with a heavy sadness experienced by so many such as that occurred on June 15th, 2023. Just this week, on October 28th, Premier Wab Kinew awarded one of Manitoba's highest honors, the Order of the Buffalo Hunt, to a total of 134 first responders to recognize their bravery and courage during this tragedy. We also thank them again for their dedicated service. Before we get started with our yearly recap, I want to again acknowledge and recognize our over 7,500 staff in Prairie Mountain Health and our volunteers. Our volunteers contributed over 37,000 volunteer hours last year. We would like to take a few moments to highlight and recognize our incredible staff. Our region's greatest strength is our staff and teams who are deeply committed to providing quality care to the people we serve. Thank you. This slide provides a snapshot of services and information about our region. Prairie Mountain Health provides a wide complement of community and facility-based services across our vast geographical region, which covers an area of 67,000 kilometers. In accordance with the Health System Governance and Accountability Act, and as approved by the Board of Directors, Prairie Mountain Health's 2023 to 2028 strategic plan was released on April 1st of 2023. Our strategic priorities are closely aligned with Manitoba Health's strategic plan. And by doing so, our goals not only guide our organization's direction, but also support the strategic direction of our provincial healthcare system. Our annual report, which is available on our website under publications, provides more information about the initiatives and activity that have helped advance our strategic priorities and goals during the 2023-2024 fiscal year. We will highlight a few of those today and also provide a quick snapshot of some of our challenges and strategies as we move forward. So currently, our top priorities are identified on this slide. In alignment with our strategic plan, Prairie Mountain Health is focusing on the priorities of improving emergency department wait times for our larger sites of Brandon and Dauphin, recruitment and retention of staff, Indigenous health and equity of services, and financial sustainability. When it comes to our strategic priority around system capacity and performance, we know that wait times are too long at the Brandon Regional Health Centre Emergency Department. Reasons for this are multifaceted, but we know that one of the main reasons is shortage of primary care providers. In the past year, we've added additional staffing supports to the Brandon Regional Health Centre Emergency Department, which includes additional nurses, healthcare aides, and mental health liaison nurses. Brandon Regional Health Centre has also added patient flow resources implemented 7 days a week and has initiated staff-led project work aimed at improving wait times and ensuring people have access to the right care in the right place at the right time. One strategy that has been implemented to support reducing the wait times in the Brandon Emergency Department is implementation of the Brandon Minor Injury and Illness Clinic. This new clinic is located on the main level of 144 6th Street in Brandon and opened in late September. The clinic is staffed by physician and/or a nurse practitioner, clerks, nurses, and social work supports who will provide care for minor health concerns and injuries. Staff at the clinic will be able to connect patients with additional services that might be required. Please visit the Prairie Mountain Health website for additional information and watch social media on hours of operation and appointment information. One of the challenges we face is the ongoing need to recruit and retain healthcare staff to address the workforce vacancies and ensure continuity of service. The recruitment of healthcare staff will improve health system capacity, reduce wait times, optimize patient flow, and enhance care experiences. Staff shortages have created pressures on all programs and have increased demands on acute care services and staff workload. Physician and nurse practitioner shortages have left Prairie Mountain Health residents in some areas with a lack of resources to manage chronic health conditions and provide preventative care. However, we have successfully recruited more than 24 physicians to Prairie Mountain Health in the last year. Notably, we have had a number of recent specialist recruitment successes in the areas of ophthalmology, psychiatry, orthopedic surgeon, spine surgery, radiology, urology, as well as internal medicine support in Dauphin. We continue to have high vacancy rates in the areas of nursing and healthcare aides, with approximately 30% vacancy rates in each of those areas, causing us to have a high reliance on agency and overtime usage. We have many ongoing recruitment and retention activities, and this slide highlights some of those activities. We have ongoing collaboration with academic institutions locally to ensure that we are providing local LPN or practical nursing and healthcare aid programming, because we know that if we can train people locally, they are more apt to stay within our region. So with that, we have the programs within Nipawa, Verdun, and Swan River for practical nursing. We have the program in Nipawa started in January 2024 with 16 students who are set to finish in August 2025. The practical nursing program in Verdon started in September 2022 with a total of 17 people graduating from that program. There's a second class in Verdon that is to begin in September 24 and will conclude in May 2026. We recently hosted a rural healthcare aid program in St. Rose through the Assiniboine College, and we take full advantage of a micro-credentialing program to train untrained and uncertified healthcare aides who are hired to the region to ensure that they have training and competency to do their work. One of Prairie Mountain Health's achievements and innovative recruitment strategies has been our Grow Your Own NP program, which trains local nurses to become nurse practitioners. We're expecting 5 people to graduate from that program in 2025 and 6 in 2026. We have a number of workplace wellness initiatives, including employee and family events such as a Summer Fun Day in Minnedosa and a Christmas movie day. We have opportunities for teams to apply for funding for their own planned events. And last year, we were able to support 60 teams in offering their own social events. Indigenous people experience poorer health outcomes than non-Indigenous people and higher rates of chronic illness. As a result, Prairie Mountain Health prioritizes Indigenous health strategies and advancing the Truth and Reconciliation calls to action. 2023-2024 saw significant expansion in our Indigenous health team, which now includes a regional manager, Indigenous health community liaison, and 4 Indigenous health patient advocates positions who provide support to our Indigenous clients and communities and to access care at PMH facilities and services. The Indigenous health team help facilitate relationships between Indigenous patients, clients, and communities, and their healthcare providers to achieve health equity and culturally safe healthcare within Prairie Mountain Health. We continue to work on an Indigenous health strategy, starting with development of a disrupting racism policy. We've established regular quarterly meetings with all 14 First Nation communities within our region, and meetings with Métis communities are planned for 2025. We support continued development of staff education related to cultural safety and disrupting racism. We also, February 2024, no, that's okay, thank you. February 2024 marked 10 years of celebration on the road for the mobile clinic care bus. This bus was the first of its kind in the province, and although some of the faces and places have changed every year, there's been one constant, which is providing access to services where some barriers remain. On average, the Prairie Mountain Health Mobile Clinics travels 44,000 kilometers annually, which is roughly equivalent to touring Canada east to west nearly 7 times every year. The mobile clinic is staffed by nurses, nurse practitioner, and a driver who also provides administrative support. The team works closely with the staff at health centers in each community to ensure individuals' needs are met. Currently, the Indigenous communities of Birdtail Sioux First Nation, Ebb and Flow First Nation, Ochichak-Ko-Sipi First Nation, Kisikowian First Nation receive regular visits. Other First Nations communities in our region also receive regular visits from nurse practitioners. So for sustaining financial sustainability is also a PMH priority at this time. Prairie Mountain Health has forecasted a $41 million deficit for 2024-2025, with incremental agency and overtime as the main driver. Our CFO, Dan McGregor, will speak more about our financial position later on in this presentation. In terms of activities to address the concerns around financial sustainability, a number of activities have been established within the region. We've established a financial accountability working group scrutinizing potential cost savings opportunities, mostly focused on staffing resources and the costing that we're expending there. We are using provincial travel health nursing team to reduce reliance on private nursing and agency staff. And we are engaging in efforts to ensure continuous cost savings. So other highlights from 2023-24 include our success with the Accreditation Canada survey. So much preparation went into preparing readiness for the survey, which took place this past May. The survey assesses all aspects of operations from board to leadership to care and services to infrastructure. Prairie Mountain Health met 97% of the survey criteria and 23 out of 30 required organizational practices. We will follow through on all areas of improvement that were identified in the final report. Patient and family engagement is a key component of what we do, and this was recognized strongly within the survey. A huge thank you to all of our staff and for the commitment that you show to continue to bring to your work every day. The full report on our accreditation results are available on the PMH website under the About Us section. This fiscal year also saw Dinsdale PCH transferred to Prairie Mountain Health, and we welcome Dinsdale to our PMH family. We've also seen the electronic patient record enhancement implemented at Prairie Regional Health Centre, which enables electronic documentation at that site. We've also seen upgrades to patient registration services at some of the rural sites in our region. In terms of mental health and addiction services, we've seen some enhancement of services across our region, including increased service and program enhancements at Willard Mountain House in St. Rose and Parkwood in Brandon. Prairie Mountain Health was fortunate to be able to also implement mobile withdrawal management services within the region, serving Brandon and the surrounding area. This service provides another option for individuals wishing to withdraw from substances with support while in the community and in their homes. So getting into some of the capital project updates, we'll start with Dauphin. So the Dauphin Clinical Space Redevelopment Project continued throughout the year. The cancer care and chemotherapy unit located on the hospital's main floor opened in January 2024. The new endoscopy suite on the main floor was completed and is set to open soon. The project's second phase is nearly completed, with renovated space for 9 additional inpatient beds being completed. The renovated space for the new physiotherapy area and conference room with some administrative offices has also been finalized. Moves into these new renovated spaces are set to occur over the next couple of weeks. We also saw emergency department renovations be completed in Verdon, Killarney, and Souris. These enhancements will improve safety to patients and privacy during the triage process. Safety security projects also occurred throughout the region. The Prairie Regional Health Centre critical care expansion is underway with a new 16-bed ICU unit planned for the main level. On the second floor, we will have 30 additional medicine beds that will be more intensive medicine service. The third floor will be mechanical space, and the fourth floor will be shell space for future expansion. The anticipated opening for the critical care bed tower is winter of 2026. The Nipawin new hospital will include a 60 acute care bed expansion, up from the 35 beds that are available currently. And it will include an expanded emergency department. There will be an addition of a hemodialysis suite with 9 dialysis stations. There will also be enhanced space for surgery, diagnostics, and palliative care, as well as outpatient services such as chemotherapy with 6 treatment stations. The anticipated opening for the Nipawin new hospital is late 2026, early 2027. We saw significant community contributions enable the opening of the Community Cancer Care Center in Russell, Manitoba. The construction was completed in summer 2024 and opened for clients in mid-July. The space is 4 times what was available in the previous unit, and the local ECCC group raised a total of $2.9 million for this capital project expansion. That group has contributed towards the construction of a new parking lot, which has just been completed. Swan River received a new CT scanner, which was installed and operated in the spring of 2024. 2 local X-ray techs were trained and are operating the unit. The local communities raised over $1 million for this project, and the CT is to serve a population of about 14,000 residents and has been well received to date. The Western Manitoba Cancer Centre has expanded treatment spaces, and the Paul Albertson Centre of Hope added to its expansion. There has been a new linear accelerator for radiation therapy added to the building, replacing an older one that has been in the building since it was built approximately 10 years ago. The anticipated opening for this facility is probably early November. From here, I will pass it over to Shep Castra and Dan McGregor to review our 2023-2024 audited financial statements. Thank you.
Thank you, Trina. My name is Shep Castra. I'm the chair of the Finance Committee. I'm also a member of the board. I would like to acknowledge the work done by my fellow board members, which are Jana Knight and Lon Cullen, and we all have an interest and competency in financial literacy, which helps us fulfill our role on the Finance Committee. What does a Finance Committee do? We meet at least 10 times a year to review the financial status of Prairie Mountain Health. The committee is also involved in reviewing the operating and capital budget that are prepared by management, and we will forward those on to the board at large for approval. The Finance Committee is also involved in recommending the appointment of the external audit firm and reviewing the audit results. At this time, I would like to call on Dan McGregor, Regional Lead, Prairie Mountain Health Corporate Services and Chief Financial Officer, to provide an overview on our 2023-24 audited financial statement. Thank you.
Thanks, Shep. I would also like to acknowledge all the time put in by the board members as part of the Finance Committee and appreciate their contributions. A summary version of the audited financial statements is included in the annual report, and a complete set can be found on the PMH website prairiemountainhealth.ca under the About Us Regional Reports section. The auditor's report confirms that the audited financial statements present fairly the financial position of Prairie Mountain Health. The auditors issued an unmodified audit opinion, which means that no significant issues were found during the audit. I will speak to some of the notable changes from the previous year on the statement of financial position. You will note that the assets have decreased from the previous year by approximately $30 million. This is mainly due to a decrease in available cash related to the operating deficit that I will speak to on the next slide. The long-term debt in the liabilities section has increased from the previous year by approximately $125 million. This is mainly related to the Brandon Hospital expansion and the new Neepawa Hospital capital projects. You will also see the related increase in the tangible capital assets. PMH ended the year with a net deficit of $32.9 million. This includes a $29.7 million operating deficit and $3.2 million related to capital. It should be noted that the capital deficit is related to accounting practices that result in a timing difference between the funding received and the amortization of the capital assets and does not impact the operating budget. As Trina spoke about earlier, the main driver of this deficit was agency and overtime costs that relate to vacancies in the region. By legislation, PMH is required to submit a balanced operating budget to the province. The 2024 budget amount showed a balanced operating budget and a $1.9 million capital deficit. However, it should be noted that our budgeting process that began in 2022 estimated that there would be approximately a $30 million shortfall. Therefore, this deficit was anticipated and consistent with our original budgeting process. This chart shows the allocation of expenses between the various programs and services within PMH. To highlight some of the larger expense areas, the large blue area shows that 38% of the costs relate to acute care services. The next largest area, 27%, relates to personal care homes. 18% includes the total for community-based services, including home care, community health, and mental health services. 8% relates to physician remuneration, and the miscellaneous expenses mainly are related to items like minor capital and ancillary expenses. This chart shows the various revenue sources for PMH. 86% of the funding is from the Provincial Government Department of Health, Seniors, and Long-Term Care. 6% of the funding is from the Provincial Department of Housing, Addictions, and Homelessness. 5% of the funding is from residential charges from personal care homes. And other revenue includes items such as ancillary and interest income. And that completes the financial summary of activities for 23-24. And with that, I will turn it back over to Lon.
Thanks, Dan and Shep. This brings us to the end of our scheduled presentations, and we will now move on to a question and answer session. We have some time until our adjournment at 1 o'clock. I'll turn it back to the moderator who will facilitate this.
Thank you, Lon. As you know, the microphones are muted to avoid noise interference on the call. And at any time, you can click on the chat icon at the top of your screen and type in your questions. In case of time constraints, we'll be allowing it to 2 questions per person, and we'll go back to the other if there's more questions with time permitting. If you are joining us by phone, you can submit questions via email to communications@pmh-mb.ca. And as a reminder, our annual report and financial statements are available on our website at www.prairiemountainhealth.ca and just by clicking on About Us. And you can always contact us by email with any questions, even after the meeting, at communications@pmh-mb.ca. Just gonna move over to see if we have any questions. With me. Okay. Our first question we have here is how much was spent on agency nurses? Dan, would you be able to answer that?
I sure can. I threw it in the chat there also. I'm not sure if everybody can see that, but for agency nurses and healthcare aides, it was approximately $46.7 million in 23-24.
Okay, thank you. Next question we have is what does the acronym ECCC stand for? What that fundraise for your capital projects? Trina?
Yes, a trick question because I always have to think about this, but I believe it is Expanding Community Cancer Care. And it's based out of Russell, that community-based group.
Okay, thank you. Next question is, how is Prairie Mountain Health gauging if their Indigenous health, cultural safety, and equitable access is disrupting racism in patient care? If we have any measurements.
Yeah, that's a very good question. Thank you for that question. Recently, the province has engaged in the effort of collecting race, ethnicity, and REI, I'm sorry, Dan, can you help me? Indigeneity, I believe, data. So if people might have awareness that when they present to a healthcare facility that they're asked around their ethnic background, that data is going to help inform where there might be gaps that exist for different racial groups within our province. And so we have seen a very preliminary response or report of the initial data around that for Prairie Regional Health Center only. And we're very optimistic that that data will help inform actions and action planning going forward. I appreciate that question. Thank you. And I think the other way will be, surveying and getting response back from Indigenous communities and populations about access to care. Informally, we have strong working relationships with many communities. And so listening, hearing, talking to them about what's working, what can we improve on, how can we improve cultural safety will be key to us moving forward. Thank you.
Perfect, thank you. The next question we have is with regards to recruitment and retention. Trina, you had mentioned we have recruited 24 in the last year. I'm sorry, but I missed what positions that she was talking about.
Yes, hi Michelle. So that was physicians in general, including specialists and general practitioners.
Okay. Our next question we have is how much does an agency worker cost PMH versus a union position? Do we lose revenue with vacant beds? Maybe there's two questions there.
Dan or Kevin, I wonder if you can tackle that. Thank you.
Well, I'll start and maybe Kevin can add in if there's more there. As far as the agency worker cost, it's difficult to say exactly because for agency, there is a travel portion that relates to the travel time and travel expenses related to the agency nurse. So that could change depending on where that person is traveling from. Having said that, there is an incremental cost to that because of those travel expenses that would make an agency nurse generally more expensive. As far as the lost revenue, I would say in personal care homes, certainly there would be lost revenue for where we would have residential charges for those individuals in the personal care home. So having vacant beds in those areas would result in lost revenue.
Okay, thank you. How much has Prairie Mountain Health saved by ending the cost matching agreements with municipalities to recruit physicians?
I'm not sure if we can speak to that in terms of savings, but what I can say is that we really just did not have the funds to continue those agreements with communities because recruitment firms can cost significant amounts of money. So I wouldn't equate it to a savings. It's just, it was an expenditure that we were compelled to not sustain.
Okay, thank you. The Premier announced that approximately 800 healthcare professionals were hired recently. How many did PMH get and how many went to rural locations? Do we have those numbers?
No, what we can say though is our vacancy rates in our region have remained stable since last year. So we're not seeing an increase or a decrease in our vacancy rates. So although we might have hired, and Kevin Carter, our HR lead, might be able to speak to the number of people we've hired, we've sort of been equitable on, we're not seeing an increase in our staffing or an improvement in our vacancy rates as a result.
Okay. The next question is, how will we combat the growing prevalence of violence happening towards healthcare workers with our greater influx of patients?
Very good question. Certainly, aggression and violence towards staff is an ongoing concern for us. And it's sort of contributing factors are, the growing concern of mental health and addictions within our population as a globe, really. And so we are constantly looking at ways to ensure safety with staff. We've increased security services at a number of our acute care sites within the region. And we've continued ways to ensure security at sites, which include limiting the number of open doors within facilities and ensuring that we have sound emergency responses in place to support safety. I think I can mention that Prairie Regional Health Center will be undergoing a trial of a sort of an AI metal detector at the entrance in November.
Okay, thank you, Trina. Another question we have is, does PMH track patient flow from community of origin to hospital of presentation when planning for HHR and funding? Example, on the border of Saskatchewan or the border of shared health.
I think
Southern Health.
Yeah, I think what we would monitor more would be just the volumes of patients, not necessarily where they're coming from. We know anecdotally that we see patients from Eastern Saskatchewan, as we always have. Anecdotally, we hear that might be higher because some of the facilities in Saskatchewan have incurred service interruptions, as some of our smaller sites have over time. But we don't particularly track where people are coming from to inform. Although that data is available and has been scrutinized in the past.
Okay, thank
But
you.
more so, we would monitor the overall volumes and trends that way.
Okay. Well, that we don't seem to have any other questions at this point. Nothing has come in through our communications inbox from anyone on the phone as well. I'm just waiting here. Are there any other questions? Oh, here comes one. Given our current vacancy rates in direct care staff, how do we plan to staff our capital expansions?
Yeah, it's definitely a challenge. And that's why, it's really important that we're working with the local academic institutions to train people where they live. As I mentioned, we know that if we can train people where they live and locally, that they're more apt to stay locally. And so that's one of the key strategies that we have to improve recruitment and retention of our staff. And so when we're planning for NEPWA, for instance, that LPN program in that community or practical nurse program in that community is going to be a key support for us as we go forward.
Mm-hmm. Okay, I have no other questions right now. Well, I think this would bring us to the end of our time then with questions, if there are no others. And Lon, I will bring it back to you for adjournment.
Okay, thank you very much. In closing, I would like to thank everybody who took the time and interest to join us today. And I would like to say thank you for the questions, because that allows us to see what other people are thinking as well, and maybe things we haven't thought of. Very soon, we'll make this AGM presentation available on our website for those who wish to see it again or missed the meeting today. Thank you very much, and enjoy the rest of your day.
Thank you all.